Green tea. You see it everywhere, right? It's talked about like this miracle superfood, a powerful natural weapon in the fight against cancer. It's a really comforting idea that a simple cup of tea could hold so much promise. But what's the real story here, behind all the headlines? All right, let's get into it. So, this is the big question on everyone's mind. With all the buzz, you'd think green tea was some kind of definitive magic bullet. But when you actually step back from the hype and look at the hard science, well, the picture gets a whole lot murkier. And really, that's the heart of what we're digging into today. For every headline that screams miracle, there's a study with, well, inconclusive results. The truth isn't some simple yes or no answer. It's this fascinating and honestly kind of frustrating mix of data. This quote from the analysis we looked at really just cuts right to the chase, doesn't it? It's a huge reality check. Now, while there are absolutely some compelling reasons to be interested in green tea, the idea that it's a guaranteed cure is, according to the research, just not the case. So let's unpack why. Okay, so first up, let's wade into the evidence itself, which is a real mixed bag. We're going to look at why the scientific community can't seem to agree, and a lot of it boils down to just how difficult it is to study this stuff properly. So here's the thing. Not all green tea is created equal. Not even close. The amount of the key active compound can be all over the place. On top of that, you've got different studies using totally different doses. Many of them are just too small to give us solid answers, and there just aren't enough of those big, gold standard human trials. It all just creates a very noisy, confusing picture for researchers trying to find a clear signal.
And this right here is the compound you need to know about, ECGC. It's the star of the show. This is the main antioxidant that scientists believe is doing most of the heavy lifting. So whenever we're talking about whether green tea is effective or not, what we're really talking about is the dose and the quality of the ECGC.
So what happens when you lump all those challenges and mixed up results together? Well, you get an official scientific rating of borderline evidence. What that means is, yeah, there's a signal. Something interesting seems to be going on, but it's just not strong enough or consistent enough to make these big, sweeping claims. But here's the key. Borderline definitely doesn't mean useless. Because this is where the story gets really compelling. When you stop looking at the messy, big picture and start to zoom in on specific situations, that's when that weak signal starts getting much, much stronger. Just take a look at this study. It's one of the most striking examples. Researchers took a group of men who had precancerous changes in their prostate. Now, typically, about 30% of these men would go on to get a full cancer diagnosis within a year. So they split them up. Half got a daily EGCG supplement, and the other half got a placebo. And the results after 1 year, honestly, they are staggering. In the placebo group, 30% of the men, that's 9 out of 30, progressed to cancer. Pretty much exactly what was expected. But in the EGCG group, only 1 man out of 30, just 3%. I mean, that is a massive difference and a really powerful piece of evidence. And look, this isn't just some random, isolated finding in prostate cancer. We start to see a very similar pattern when researchers look at early-stage breast cancer, especially when it comes to the risk of the cancer coming back. And this number right here really drives the point home. It's from a huge analysis in 2023. It found that women with early-stage breast cancer who were regular green tea drinkers before their diagnosis had a potential 44% lower risk of the cancer returning. Again, notice how specific that is, but wow, what a significant number. And the list of these promising specific areas just keeps growing. We're seeing interesting data in bladder cancer when it's used with chemo, a big risk reduction in colorectal cancer for regular drinkers, and even some success in stopping precancerous spots from turning into head and neck cancer. The theme here is crystal clear. Context is absolutely everything. But hang on, because the potential benefits might not just be about fighting the cancer itself. There's this whole other fascinating area of research, helping patients actually tolerate the brutal side effects of conventional treatments like radiation therapy. This is such a powerful finding. If you're a lung cancer patient getting radiation, the throat inflammation can be incredibly painful. But in one trial, an EGCG solution actually gave patients more pain relief than the standard drugs. Think about that.
That's a direct, tangible impact on someone's quality of life during a really tough time.
And that same study found something even more incredible. The group using the ECGC also had a much higher 5-year progression-free survival rate. We're talking 33% compared to just over 9% for the other group.
Now, we have to pump the brakes for a second. This is a critical scientific footnote. Because the trial was small, that incredible survival number wasn't statistically secure. It's a huge clue, a signpost pointing where to research next. But we can't treat it as a verified fact just yet. And that's exactly how good science works, cautiously and with rigor.
So, after all that, the hype, the mixed evidence, the specific bright spots, where does that leave us? What are the real takeaways here if you're thinking about green tea?
Well, if you want to try and maximize any potential benefits, the research gives us some pretty clear guidelines. First, go for the high EGCG Japanese teas like matcha or sencha. Try to drink them between meals, which might help with absorption. And whatever you do, skip the milk. Any kind of milk binds to the EGCG and makes it less available. And finally, dose really matters. The studies with big results often used 5 or more cups a day, or the equivalent in a supplement.
Okay, stop. Before we go any further, this is, without a doubt, the most important slide in this entire explainer. I really can't overstate this. Green tea, especially in high doses or supplement form, is not harmless. It can, and it does, interact with medications. The research specifically flags interactions with certain cancer drugs, like a class called TKIs, and this isn't a complete list, but it's a very clear signal that these interactions are real and they can be serious. You don't want to accidentally make your treatment less effective.
So here is the bottom line, and it is absolutely non-negotiable. Do not start taking green tea supplements or drinking massive quantities of tea without talking to your doctor or your oncology team first. They're the only people who can give you safe advice based on your specific health and your specific treatment plan, period.
And just to be crystal clear, this whole explainer is designed to help you understand the research. It is in no way a substitute for professional medical advice from a qualified expert. So we kind of end where we began, but with a much sharper question. Green tea is not a cure-all, but the evidence in very specific situations, like those early-stage prostate and breast cancers, is really compelling. It just leaves you wondering, if we could move past all the hype and actually invest in the kind of big, rigorous studies this topic deserves, what other powerful roles might we uncover for this ancient drink?